Yesterday, we finished talking about general female reproductive organs, and we talked a little bit about the process of ovulation, fertilization, and then that fertilized egg, that embryo implants into the lining of the uterus and begins to grow. So today we're going to talk about what happens after that. Carly, a question?
Well, before we start, I need a drink.
Not right now.
I
So, if we think about, like we talked about yesterday, the eggs are released from the ovary during ovulation and start traveling through the fallopian tube. And that is where they can be fertilized. Once the egg reaches the uterus, it no longer can be fertilized. Even if there are sperm cells there, it's too late. It has a small window of time when that egg cell that's been released can be fertilized. So it's fertilized in the fallopian tube, and then eventually continues its travels into the uterus. It takes somewhere around a week, a little bit less maybe, to reach the uterus after that egg is released. When it does reach the uterus, if that egg has been fertilized, it travels into the uterus and then moves to the side, the wall of the uterus. And remember, the wall of the uterus, because of the reproductive cycle, has been thickened with blood vessels and is enriched, and it's waiting for that fertilized, it's an embryo now, for that embryo to stick and attach, or what we call implant, in that area. Right? And so once it does, it sort of sticks there, and then the growth continues. Where it touches the wall of the uterus is where the placenta begins to form. We talked about placenta when we were talking about the different types of mammals. Who could remind me, what is the placenta's function? Scott?
Well, it's like to hold the baby in place, first of all, in like the beginning stages, and then to like deliver nutrients and stuff.
Yeah, it's responsible for nutrients, oxygen, and waste moving back and forth from the baby's blood to the mother's blood. It's the site of exchange. So the thing to understand about the placenta is that the blood from the fetus does not actually go into the mother's blood. Arteries and veins and capillaries from the fetus are all separate from the blood vessels of the mother. So they don't connect. Blood from the mother doesn't go into the fetus, and vice versa. But in the placenta, those blood vessels run right next to each other. There are capillary networks that are right next to each other. And in that area is where oxygen can diffuse from the mother's blood into the fetus's blood. And nutrients do the same. Carbon dioxide diffuses out of the fetus's blood into the mother's blood supply. So while it's growing, while it's inside of the womb, inside of the uterus, the fetus gets all of its material that it needs, all of its nutrients, all of its energy, all of its oxygen, through the placenta. Okay, the fetus inside of the womb never has to eat. It also never has to breathe. Okay? In fact, as it's growing, the fetus's lungs are filled with amniotic fluid. They're not functioning. The lungs are one of the last organs to develop as the fetus is growing. In fact, sometimes when babies are born quite premature, often their lungs are not fully developed, because that's the last thing to grow, because really they're not needed. A fetus's first breath is after it's born. That's the first time it's going to actually take a breath and fill its lungs with oxygen. In fact, sometimes women give birth in like a tub of warm water. And they actually, some people feel like it's less traumatic for the baby to be born, because inside of the womb it's in the amniotic sac filled with fluid. And so they think that it sometimes could be an easier transition if they're born into a bath of water and then they bring the baby out. And they can do that because its lung, it doesn't need to use its lungs. As long as the fetus is still attached to the placenta, it's getting oxygen through the placenta and not through its lungs. Scott?
Isn't it born like nose plugged or something?
Yeah, I'm just saying.
I don't know, people say that. I mean,
No, we
Just like
saw
we
a
saw
video
that
and there
video.
were
We
nose
saw.
plugs in there.
I mean, there are
Oh, okay.
mucus, so there's mucus inside of the nose, and some of that is cleared out, but it's not like, you know,
Just plugs.
not, I wouldn't say plugs like earplugs that you're
Earplugs.
thinking about, but yeah, but their nose is, their respiratory system is basically all filled with fluid. The process of birth, the contractions of the uterus as the baby's being born during delivery, and squeezing through the birth canal, squeezing through the pelvis, all of that, part of it helps push some of that fluid out of the baby's lungs, so that as it's born, it's going to be able to breathe well. You know, they'll do a little suctioning of fluid out of the baby's lungs and stuff with a little bubble tube thing. But pretty much the process of being squeezed, what?
Turkey basted.
It's like a turkey basted. But as the baby's born and getting squeezed through that birth canal slowly, a lot of that's forced out of its lungs. All right. Also, the baby doesn't need to eat the whole time. Okay, it doesn't eat anything. It will swallow some of that amniotic fluid, but it doesn't have to eat until after it's born, because again, glucose, nutrients, vitamins are coming through the placenta, not through its digestive system. All right.
How long do you leave the placenta?
They don't leave it in. They come. So after, we'll talk about birth in the next slide, I think.
Do we have a video?
We do have a video, but
What?
the placenta. All right. So anyway, Rockwell asked, we can talk about it now. So after the baby is born, so it's still attached to the umbilical cord, which still goes inside the mother, still is attached inside of the mother to the placenta. After the fetus is born, though, the placenta breaks away from the wall of the uterus where it formed. And actually, after the mother delivers the baby, the placenta comes out afterwards. You know, it's a, you know, I've seen it. It's a big sort of red. It's filled. You can see it's filled with all blood vessels. And it comes out that actually the doctor will press on the mother's uterus to make sure all has come out, because if a little piece of it breaks off but doesn't come out, it can get infected. So they want to be sure that all of the placenta comes out after the baby's born. I have a story about a friend of mine was in. This friend is a nurse now, but I don't know if my friend was in high school or just in the very first stages of college learning about nursing, and they had to do a rotation in the OB/GYN section, so where they deliver babies, things like that. And so he was in the delivery room. It's the first time he's ever seen a baby being born, and so the mother delivered the baby, and so, you know, they're happy and the baby's fine, whatever. But then the doctor tells her to keep pushing. And so my friend, who was still learning, he's like, oh my gosh, it's going to be twins. And it wasn't twins, but she has to just continue to push out the placenta. But he thought the doctor was telling her that because she was going to have twins. So he was a little bit embarrassed. But anyway, he was just young and just learning what goes on. The woman has to keep pushing a little bit afterwards. Her uterus still contracts to push out the placenta, so that is how.
Wait, if there are twins, is there other two placentas?
Yeah, usually there's 2 placentas. Sometimes they got 1 placenta, 2 umbilical cords, so it sort of depends on how they implant into the uterus. All right, so the umbilical cord, we talked about it though. The umbilical cord is basically just blood vessels. It carries blood to the placenta and back to the fetus from the placenta. It's, you know, thick sort of cord of blood vessels.
What do they do with it after it comes out?
So after the baby is born, the doctor or the father sometimes will cut the umbilical cord. Okay, it's kind of like a rubbery sort of, it's like a hose, but you just cut through it. The doctor then puts a clamp on it, a little plastic clamp. If you ever had little newborn babies that you've seen, they put a tiny little clamp real close to the baby's abdomen, and then they cut it off pretty short. But then there's little stub of the umbilical cord that's still on, and after it's clamped, several days later, it basically dies, it turns black, and eventually it falls off. And then the baby's left with a normal navel, a normal belly button after birth. So they just clamp it down and then cut it close by.
Wait, so there's just a belly button under there? There always has been? It's not like a shrink
I thought
slide?
there's so
That's
many
that it looks like.
No, they clamp it and it heals, it heals up tight. Sometimes they tie it with a string there and then clamp it, but it just depends.
How come some are in and out?
It just happens to be with how much of the umbilical cord is left, and sort of just the anatomy, the position, and how it heals determines if it's an innie or an outie. Just sort of. So that umbilical cord. Thanks for sharing. Connects the umbilical cord connects the fetus's blood supply to the placenta. There's no nerve receptor or anything, so when you cut it, it's not like it hurts the fetus. But then it comes out along with the placenta. And again, you see that the baby, this shows some of the arteries and veins, and they bring the blood to the placenta for nutrients and back out. Okay. Now, gestation is a word that means how long it takes for the embryo and fetus to develop. Different types of animals, it's different amounts of time. In humans, and what do we usually say? How long does a pregnancy last?
10 months.
Okay. A lot of people say 9 months. It's really closer to 10. It's really 40 weeks is sort of the average. But there's a range. Some women give birth before they're 40 weeks. Some give birth after 40 weeks. Generally, they don't want a woman to go much past 2 weeks past when her due date is. After that, they generally might induce labor. There are certain medications that the doctor can give the woman that start labor happening for her. So if it's been too long that baby needs to be born, they'll give her those medications.
That happened to me. That's why me and my ex were far apart.
Oh, really? Your mom had to be induced into labor? Yeah, my wife, for our first daughter, had to be induced. First daughter had to be induced, and it's a hormone basically called Pitocin, which is a hormone that causes the uterus to begin contracting, and the mother produces it naturally. But if it's happening a little too slowly, or they want to speed it up for some reason, they may give the mother an injection of more Pitocin that gets it going much more quickly. Harley?
What happens when babies are born premature?
So when a baby is born, 38 weeks is sort of the normal full-term development. But often babies are born before that time. And generally the closer they get to 40 weeks, the better. Because the time they're in the uterus growing means their organs are developing. In some organs, there's a difference in how quickly the organs develop. Like the heart is one of the first organs to develop inside of the embryo. You can actually hear the embryo's heartbeat at like 10 weeks. The doctor put a little speaker on there through the mother's abdomen. You could hear the heartbeat. The brain, kidneys, and things like that develop pretty quickly in the digestive organs. Some of the last are the lungs to develop. And so if a baby's born, at 37, 36, 35, 34 weeks, the farther back it is, the less developed the baby is, and the more medical treatment it's going to need to help it grow to full term and to help make sure that it survives. Because a baby born far too early, lungs are not developed enough and it can't survive. So it sort of depends when. But often a baby that's born premature, they'll keep it at the hospital longer. They'll keep it in an incubator, like a warm area, to help it continue its development. There are injections they can give a fetus that can allow their lungs to develop more quickly if they're really young. But oftentimes, babies that are born very premature have a difficult time growing and developing because they're no longer inside of the womb. John?
Like whooping cough, is that caused by like too much amniotic fluid in the
No, it's caused, that's a viral disease, I believe. So it's not caused by the amniotic fluid.
Why is it so common in newborns?
I don't know how common it is. I'm not sure that it is that common. B?
Instead of having like the woman hormone maker have labor, couldn't they just cut her open?
The doctors would always prefer that a woman goes into labor on her own, naturally. And like doing a C-section is sort of the last resort. They always, because it's a more difficult recovery for the mother, because her muscles have to heal and so on, they want the mother to give a vaginal birth first. That's what they want to happen. Usually they'll only do a C-section if there's some sort of problem. If the fetus is in distress, or if it's not getting enough oxygen and they think there's a danger that it could be in trouble, then they may do the C-section. But they'll try those other things first because they want the mother to give the natural birth if they can. All right, so I've been using these terms. We talk about a zygote is the fertilized egg, just the single cell. Once it divides, we start to call it an embryo. Later on, we call it a fetus. And the difference is the way we use the term differently. We call it an embryo is between 0 and 8 weeks. After 8 weeks, we begin to call it a fetus until birth, and then we call it a baby.
What about a zygote?
Zygote's the first stage, only the fertilized egg. It's only a zygote for a short few hours maybe until it divides, then we call it an embryo. So, placenta, umbilical cord.
You don't watch that movie thing now?
Oh no. So when I think do we have a slot? Do we have notes or do we have the animation?
Animation.
Oh wait, there's one?
Oh no. So in development.
Wait, we have to write this?
Yeah, phones now. So as the fetus is growing inside of the uterus, we would call it the womb as well, same thing, means the same thing. This is obvious, this is later on, as the baby's just about close to being born. So if we look at inside, what would this be? It's a fallopian tube. How about this? The whole thing? It's the uterus. Attached to the wall of the uterus is a placenta, right? Connecting the fetus to the placenta is the umbilical cord. When my wife and I had most of our daughters, for some reason they all had fairly short umbilical cords. And so sometimes when a woman's in labor and she's at the hospital, they can hook her up to a couple things. One is a heart rate monitor that they strap across her abdomen that monitors the fetus's heart rate. Because they're generally pretty high, like 110 or 120 beats per minute. And they want to keep a close eye on that. If it starts to drop, it means for some reason there's some sort of distress for the fetus during birth. They also can measure the amount of oxygen that's being delivered to the fetus, and they keep a close eye on that. Because if the fetus during birth, sometimes the umbilical cord gets wrapped sort of around their neck, or gets like a hose, gets kinked or twisted, and that prevents blood from flowing through there, and it causes the fetus's heart rate to drop, and cause them not to get enough oxygen. And if that happens for too long, then they could have damage to different parts of their body, or brain damage because they didn't get oxygen. So they need to be careful of that. And so one of the things that happened with, I think all 3 of our kids, is that they would see during delivery, sometimes their heart rate would start to fall. So one time I remember my wife was in labor and they were watching, and all of a sudden the heart rate went way down, and the monitors beep, and the nurse came running in, and she took my wife who was laying on her back and just flipped her over onto her side. And what they do is they try to hope that the baby's position shifts, because maybe they were putting some pressure on that umbilical cord or something. And generally every time it would come back up, but it's sort of nerve-wracking as they're watching that little monitor. But that's the situation, like I said, if the baby's heart rate dropped down but wasn't coming back up, that they might do like an emergency C-section to get that baby out as quickly as possible, so there's no chance of having any damage. Now this, we haven't talked about this yet. But the fetus is not just inside of the uterus, but it's in another layer beneath the fetus.
I think it's the amniotic sac.
Yeah, it's the amniotic sac, which is filled with amniotic fluid. Does anybody know what's one of the ways that sometimes a pregnant woman knows she's going to be having the baby very soon? Her water breaks. So what the heck does that mean?
It means
It
there's
means
some
that the amniotic sac bursts.
It comes out of.
Yes, it means that this amniotic sac, at some point, it ruptures. And not always, it usually breaks, okay, as the baby's ready to be born. And so some of the amniotic fluid that was held inside of the amniotic sac leaks out through the vagina, and that means her water broke. And what that means is now that seal that was sort of protecting that fetus from any bacteria and stuff getting in is now broken. So usually after a woman's water breaks, the doctor will want her to give birth to the baby within like 24 hours or so. You know, if she does, usually that begins labor, and so labor will start and she'll start having the baby. Sometimes it doesn't. Sometimes her water breaks, but she still doesn't go into labor. So like I said, the doctors won't let that go on too long, because then there's a chance that bacteria could get into the womb and start an infection. So they'll want her to have the baby pretty quickly. Sometimes the amniotic sac doesn't break, and the woman's going into labor. Sometimes the doctor, if they want labor to happen a little more quickly, is they'll actually puncture the amniotic sac, just with a little sort of probe, puncture it, and that usually speeds up labor and delivery. Because as the fetus starts pressing against the cervix, it starts this cycle of releasing more hormones, which causes the cervix to open up, causes the uterus to contract, that pushes the baby harder against the cervix, which causes it to happen again and again. And so when the woman is in labor, she gets contractions. I'm sure you've heard about contractions. Contractions are the uterus. The uterus, remember, is just a hollow muscle like a balloon. Is the uterus contracting? That's what contraction comes from. It contracts, and it starts off pretty weak, sort of. A woman can feel it, and they're spread apart. They could be 15 minutes. Every 15 minutes, maybe she gets one. She could feel it. As labor is getting closer, as the baby's getting closer to delivery, they get closer together. They become more intense. And what's happening is the uterus is contracting and pushing the fetus a little bit through the birth canal, a little bit through the cervix. It's opening up the cervix so that the baby can fit through. And as delivery is about to come, as the baby's about to be delivered, they're very close together, one right after another, and they're very intense. And that helps to push the fetus out through the cervix, through the vagina.
Could a baby be born without, like, with the sac around it?
No, not that I know of. It always ruptures. Once labor is very close, you know, the doctor will rupture it if it's not.
Like, break it?
Yeah, because it's squeezing it lower and lower, eventually will rupture. Also, have you ever heard of a procedure called amniocentesis?
No.
All right. Sometimes when a woman's pregnant, the doctor will want to take a sample of this amniotic fluid.
No.
They use a big needle.
But won't that rupture?
But a very tiny needle that won't rupture and allow it to break, actually.
Well, why wouldn't you just like get it
What if
when
it's
it's
a
coming
baby?
out?
What's that? Because they want it early to make sure that everything's healthy with the baby. By looking at that amniotic fluid, it has cells from the fetus in it. They can see if it has the proper number of chromosomes. They can tell whether it's a boy or a girl. They can tell some other things about the fetus by sampling that fluid. They know exactly. They use an ultrasound probably to see where the fetus is inside of it. Then we have the fetus itself. Which way are babies usually born? Head first is the typical way, is the easiest way for the mother. You know, the fetus will move around, you know, as it's growing, but eventually as the woman gets closer to the time she's going to deliver, generally the fetus will turn so its head is down, and then that's the way it fits through the cervix and the pelvis. The easiest is head first. What's it called when it's not in that position? There's a word for it.
The fetus.
The baby's in a breech position. Have you ever heard of that?
No.
And so sometimes the baby can be delivered feet first. It's a little bit harder. Sometimes if the doctor sees that it's getting close to, you know, the full term, the doctor, if it's not in the correct position, sometimes the doctors try to move the fetus into the correct position by basically the woman going to the doctor and he grabbing her abdomen, trying sort of from the outside to sort of guide this fetus into the proper position. And it's weird because when a woman's pregnant, sometimes, like, especially towards the end, you could see, like, sometimes a foot pushing against, you could see it sort of coming out of her stomach, a little foot pushing against there. And if you feel it, you could feel that there's something there, a hand or a foot, because it's there, and it's big, and it's right next to there's a thin layer of the uterus, the muscle, and then the skin, but you could still feel those parts in there. A woman can feel the fetus tick inside of her, and all those other things.
My brother was born feet first.
He was born feet first? Yeah. And so that does happen sometimes.
What was the first like body system that maybe like developed?
The nervous system is the heart. The heart's one of the very first organs to begin functioning. All right, and finally the cervix, the opening of the uterus. And throughout pregnancy, it's closed off. It actually has a plug in there, a mucus plug, that again prevents any bacteria from getting in to the fetus and infecting the womb. During labor, as those contractions happen, the cervix opens up or dilates. And so when they say a woman's 4 centimeters dilated, they're talking about how open the cervix is. It needs to get to about 10 centimeters dilated. That's fully dilated to allow the fetus actually out of the body. So the doctors check that periodically when she's in labor. That helps them know how close to actually giving birth she is. This is what the embryo looks like. This is the very first stages after it's just reached 8 weeks. And we call it fetus. Very small, but still identifiably human. You could see the umbilical cord. You could see the amniotic sac that's formed. What would this be? What's that? It's just the background. I don't know if they artificially colored it. A little later on. Okay? I don't know. It's just they can take actual pictures of using like these tiny little fiber optic cameras. They can get images of what the embryo and fetus looks like inside. This shows sort of a time lapse of how it changes from the very first stages. Oh, wait, sorry.
Looks like Chris Bosh.
And so again, in the early stages, the early weeks, it's it doesn't really look like much. But then eventually, as time goes on, it starts to.
Are we mermaids at first?
It is.
Has an ugly face.
That's
That's a big head. That's
Some of these things don't develop until later on.
Look at that big foot.
What? That's exactly.
All right, this will be our last slide today. So this is what? No.
The fetus.
Uterus, pelvis, vagina, cervix will be up here.
Looks like a head.
This just shows generally how the baby moves through the birth canal.
It looks like a dinosaur, doesn't it?
It does, kind of.
It looks like a rhino.
So as the contractions happen, the fetus moves into the pelvis, head first. After the head gets through, then the shoulders will generally rotate, so they fit through the easiest.
Whose spine
It's the woman's spine. Head first.
Oh my god, I'm so glad
Once
I'm
the
a girl.
shoulder, see again, you see that rotation? Shoulders come through. Then the rest comes through a little bit easier, followed by the umbilical cord and
It's a girl.
the placenta would break off and come out afterwards. What's that? That's the uterus. That's not the. This didn't show the amniotic sac. This is the vertebrae. Yeah. That's the pelvis. Now you know all about childbirth. All right, let me show you the next slide. This is so if you don't like the surgery kind of stuff, you probably don't want to watch. But this is a video of a baby being born via C-section.
Doesn't the baby poop after it comes
So, listen, it starts with animation, then it actually shows us.
In a woman's abdomen and uterus to deliver a baby. Some cesarean sections are planned. More often, however, the need for the procedure becomes apparent after the
Book club members, you will be meeting this afternoon after school. Thank you.
Let's finish this.
When abnormal conditions make a vaginal delivery unsafe for the mother or her baby. Common indications for cesarean section include dystocia, placenta previa, and fetal distress. Dystocia, or prolonged non-progressive labor, can occur when the baby's head is unable to fit through the birth canal or its body is in an unfavorable position, such as perpendicular to the birth canal or buttocks first, which is the breech position. Placenta previa occurs when a low-lying placenta partially or completely blocks the cervical opening. Fetal distress occurs whenever the health of the baby is in imminent danger, usually from inadequate blood flow through the placenta or umbilical cord. Fetal distress can occur when the placenta separates from the wall of the uterus prior to delivery or the umbilical cord becomes compressed or squeezed. Other conditions that may require a cesarean section include multiple births, large tumors of the uterus, genital herpes or other infections, or medical problems such as controlled diabetes or hypertension. Your doctor may use ultrasound testing or fetal heart monitor to help decide whether your baby should be delivered by cesarean. When a cesarean section becomes necessary, you will be prepped for surgery. If not already in place, an intravenous line will be started, and a catheter will be inserted into your bladder to drain urine. In the operating room, you will be given anesthesia. In most cases, a spinal anesthetic is administered to numb the lower portion of your body. Sometimes, however, a general anesthetic will be used. Your doctor will begin by making an incision in your abdomen. It will either be a vertical incision from just below the navel to the top of the pubic bone, or more frequently, a horizontal incision across and just above the pubic bone. This is often called a bikini cut. Your doctor will then make a second incision on the lower part of the uterus. Once the uterus is opened, your doctor will rupture the amniotic sac if it is still intact and deliver the baby. The time from the initial abdominal incision to birth is typically 5 minutes. Your doctor will then clamp and cut the umbilical cord. Gently remove the placenta and tightly suture your uterus and abdomen. This typically takes about 45 minutes. The hospital stay after a cesarean section is usually 3 to 5 days. During this time, you will be encouraged to breastfeed.
It will.
It will.
It will.
Bed often. While most patients are able